So you wake up tired, or you're having trouble falling asleep? If so, then this segment is certainly for you. We welcome in Doctors Sriharsha Vajjala from the Sleep and Insomnia Center and Patricia Borman from the Memory Disorder Center. Thank you guys so much for being here. I myself have sleep apnea and have to wear the CPAP machine to go to bed and to sleep. But sometimes I do wake up tired. So thank you so much for being here, and I know people suffer from it. Let's start off by asking, how many hours of sleep do we need, and how does that change as we age?
Sure, John. Thank you for having us here. So usually adults require 7 to 8 hours of sleep, no more, no less.
7 to 8?
7 to 8,
okay.
Yes. And kids, on the other hand, need more than 8 hours, and it depends on their age as well. The younger they are, the more number of hours you need to sleep.
Okay, that's actually great, although there's a lot of us that don't get those hours of sleep. If I snore, how about this question? If I snore, does that mean I have sleep apnea?
Well, you have a high chance that you might have sleep apnea. Just to tell you some numbers, 40 to 45% of men snore, and 20 to 30% of women snore, and a third of them have sleep apnea.
Okay.
So it is very important that if you snore, you talk to your doctor about this, or seek to see a sleep professional. Because sleep apnea, it not only disturbs your sleep, but it has profound health consequences. It can affect your heart health and your memory as well. So it is very important to talk to your doctor if you snore.
So snoring, sleep apnea, just to throw it back out there, affects heart health, and
brain health.
And brain health. How do I get a better night's sleep then? I'm sure a lot of people want to know the answer to this.
I found it interesting to learn that we actually need to train ourselves to sleep.
Okay.
I think of it as a recipe, that if you try to make a cake without a recipe, it might not be the best cake.
Yeah.
But there are definitely specific steps. Right, Dr. Vajjala?
Yes, I totally agree. Just a few important things. The most important thing that I tell my patients is try to not use bedroom for anything else other than sleep or sexual activities.
Okay.
Your bedroom should be a sleep sanctuary. As soon as you enter the bedroom, your brain should start thinking about sleep.
Okay.
You start playing on your phone or watch TV or work on your computer, that association is gone and you cannot fall asleep.
Okay, so that's really great tips. That makes a lot of sense too, and I'm sure for a lot of people it's like, bing, the light has gone off. Okay, sleep. What about naps?
Well, we get a lot of questions about naps, and for healthy adults, a nap can be refreshing, but it should be limited to about 20 minutes to half an hour.
And a lot of people know that any more than that, you feel groggy anyway for the rest
You
of the
can feel more groggy. But as a geriatric specialist, I try to remind my patients that if they are ill, if they're recovering from a hospitalization or some type of health issue, then let your body call the shots. You do need extra sleep to heal.
Okay. And a lot of people might not know that not being able to sleep or having this type of problem would affect your heart, but boy, we would certainly want to reinforce the fact that it does affect your heart health. What are some of the clues that somebody might have a sleep problem? And then on top of that, what should they do about it?
Well, I think sleep problems, if you wake up and you are not refreshed, I want you to see a sleep specialist.
Okay.
Also, if your sleep is frequently disrupted at night, it could be pain, it could be other health concerns, it could be psychological if you're not handling stresses and strains that happen in your life.
Okay.
And I'm sure doctor has some ideas for when to seek help as well.
Yeah, definitely to add on to that, if you're not satisfied with sleep in any way, in other words, if you're sleepy when you're not supposed to, or if you're not sleepy when you're supposed to sleep, that itself is not a good sign, and that's when you should seek help.
Okay.
And most of the times it's simple things. that can be fixed easily. Sometimes it needs a little more work, but definitely do not neglect sleep and talk to your doctor about it.
This is all great info we're going to have on our website shortly after the show. You have something on your lap that you'd like to share with us?
Yes, my specialty in the memory clinic is dealing with very many seniors in our community, and I wanted to be sure to share this booklet called Senior Information and Assistance, and it's a wonderful compendium of resources in our community for the kupuna, and it's so helpful. I give out boxes and boxes and boxes, so it's a very nice resource for the older population.
How can somebody get something? How can they get that from you?
Well, there's many stores that have it. It's printed by the Mayor Kirk Caldwell and published as a public service for Hawaii. And it's formulated by the Agency Area on Aging. Mm-hmm. And every geographic section of our country has an area agency on aging to support services and resources for the elderly.
Thank you guys so much for being here. I appreciate it. And so does our viewers. There you see some information on how you can get a hold of the doctors and find out a little bit more. I think it's important. HawaiiNeuroscience.com, and then there you saw the phone number on the screen. We'll have that information on our website as well shortly after the show. Thank you guys so much.
Thank you, John, for having us.
All right.